Assalamu alaikum. Today is my morning walking day, day 18, and I am talking live from very beautiful morning uh, morning walk. And today my topics is about the connection between mental and physical health, how it's influence each other. Actually, there was the old idea that mind and the body is significantly outdated. Uh, Here's if we uh, explain about the mental health, how uh, affects the physical health. So, if we come to the stress response, the primary pathway, the when we experience like stress and anxiety, the depression uh, activates its fight and flight response that actually release some sort of hormone like cortisol and adrenaline. So what actually they do, they actually protective uh, uh, to our body, uh, avoid an accident. The when the chronic, the like long term mental distress is persistent, the system always stayed activated. That actually the problem is the they increase inflammation to our body, and like various kind of disease like arthritis and autoimmune disease and high blood pressure and so many systemic disease like that actually weaken our immune system, that makes you more susceptible to any infections and slows the healing. Sometimes it also the like the cortisol hormone that increase your blood sugar level. So thus that increase the possibility to developing the type 2 diabetes. So actually the thing what I would like to uh, elaborate here, that's like the in short term, when we are so stressful in stressful condition, that actually uh, good for health, but when we are distressed for the long term, the body usually following release of the such hormone as we mentioned earlier, the cortisol and the adrenaline, that actually make the thing worse in the long term. Short term it helpful for the health, but in long term it actually affects our body system. Thus sometimes it also linked to the developing the type 2 diabetes also. So another thing that we're gonna discuss, the impact on the health behaviors, the uh, indirect pathway. So mental health conditions often make it the incredibly difficult to maintain the healthy habits. Like the when we are in the stress, there must be the sleep disruption. Thus, anxiety can cause insomnia and depression and non-restorative sleep. Like poor sleep tied to the obesity and the impaired our immune system, the diet and nutrition, depression can lead to the loss of appetite and sometimes the binge eating. Like when we are so stressful and we're gonna get so many food at a time, and sometimes our physical activities that become the low motivation, fatigue, and sometimes the low self-worth that commonly find in the poor mental health. So thus harms our cardiovascular health, muscle tone, and the mood regulation. Substance. Sometimes the people who are in the severe distress, they used to get so many substance like the alcohol and tobacco and sometimes the drugs to cope up with the situation, which have severe direct physical consequence. And sometimes the neglect of the care and the depression and sap the energy to schedule your doctor's appointment. So specific the physical health condition linked to the mental health, uh, like as we mentioned earlier, cardiovascular disease, chronic stress, anxiety, and the depression are the major risk factor for the mental health that affects our physically uh, influences. Sometimes it also causes the severe blood vessels disease like the atherosclerosis and sometimes the gastrointestinal problems like the gut and the brain are directly connected via the gut and brain axis. So stress and anxiety can cause or worsen the IBS, irritable bowel syndrome, ulcers, and the acid reflux and the nausea. So actually the gut microbiomes that affected by the mental state, that if you are in the very stressful condition, then it's gonna uh, hampers you the normal activities in your guts. So thus that can worsen your physical health simultaneously and weaken your immune system. Chronic stress hormones that suppress the immune function. uh, People with the chronic anxiety and the depression may get sick more often like colds and may have the poorer response to the vaccines. Also that's the making the problem to the neurological and endocrine like seizures and the thyroid imbalance and so on. So actually the thing here I would like to emphasize here on that how our mental health is very important for uh, our physical health. So we must have to focus much on our mental health in order to have a good physical health. So so that was the topics for today, and I'm signing out from the today's morning session, and that was the my day 18 out of 100-day morning walk challenge. So congrats to the my followers, those who are following me through the pathway, and I'm grateful that I can at least make some impacts on you guys' lifestyle. And thank you. Assalamu alaikum.